What are cluster headache remission periods? Imagine having a headache so intense that it feels like a hot poker is stabbing into your eye, and then suddenly, it stops. That break is what we call a remission period. These are the times when someone with cluster headaches feels no pain at all. It's like a pause button in a very painful cycle. Cluster headaches come into main types, episodic and chronic. In episodic cluster headaches, people have specific periods where they get these severe attacks. These active phases, called cluster periods, usually last from 2 weeks up to 3 months. During these times, attacks happen almost daily, sometimes several times a day. After a cluster period ends, there's a remission period where no headaches occur. These remission phases can last at least 3 months, but often they go on for much longer, sometimes even years. People with episodic cluster headaches often notice a pattern. The attacks tend to happen during certain seasons, like spring or autumn, and then they stop for a long time. It's almost like the headaches follow a seasonal rhythm. On the other hand, chronic cluster headaches are different. They last for more than a year without a break or with very short remission periods of less than 1 month. In this case, the attacks happen almost all the time, with little to no relief. The reason why these remission periods happen is not fully understood. Scientists believe that a part of the brain called the hypothalamus, which controls biological rhythms like sleep and wake cycles, might be involved. This area could be responsible for the cyclical nature of these headaches and their remission phases. Knowing about remission periods is important because they give patients a break from the pain and symptoms. During these times, the person feels normal and can go about their daily life without the constant fear of an attack. Treatment strategies often focus on managing attacks during the active phases and sometimes trying to extend the remission periods. Medications like oxygen therapy, triptans, and preventive drugs such as verapamil are used to help control the attacks and possibly influence the length of remission. In summary, remission periods are the headache-free intervals that can last months or even years in people with episodic cluster headaches. They are a key part of understanding and managing this condition, offering hope for relief and better quality of life.